Thanks very much, Patrick. And let's look to pick up on some of those points that you talked through as you went through those different analytical methods in terms of which test is right for you. So maybe if we start, let's begin with those more simple testing methods. And you talked about the AccuScan Gold, and you talk about Raptor. When you think about the little ELISA strips that those kits are using, those lateral flow devices, what's the benefits of those strips, and how do you see more people using them in the field?
It's a good question. To be honest, the strips themselves are great. They are a good setup. It does tend to let you get an answer almost instantly. Like I will say that LCMS, you do have to do a bit more sample prep and carry out a bit more analysis, and because of that, then you do get a more sensitive analysis and turnaround. But the Raptor, if you have a problem on farm or with a feed mill or anything like that, this type of setup, these lateral flow strips with the Neogen Raptor will allow you to get a reading straight away, almost instantly, then and there on site, so you know whether you need to progress further and carry out more analysis, or if you're happy enough finding that you have found nothing. Now, again, it really comes down to the application and who and when you're using it. But the key benefit for those type of units, Nick, is that being able to use it on site straight away and find out if you have an issue or not is key. And like I said, then if you want to progress further, you know where to go. There's another more sensitive method out there for you, but they are great tool, and as I said in the presentation, it's the first line of defense nearly for mycotoxin detection.
So when you think about it, and that's what strikes me, that first line of defense and the concept of quality control programs, for instance, when we think about the fact that those rapid test kits that are really focused on individual ingredients that are coming into a feed mill or into a farm, and those rapid methods being used as a screen for those, really focused on some of those key mycotoxins, those sort of 5, 6, 7 key mycotoxins as a quality control screen.
Yeah, exactly. And I suppose the main thing is to know, I mean, feed mills have thousands of tons of feed coming in day out, and different ingredients arriving on site every hour. To turn around and say that you need to test every single kilogram or even ton is nearly impossible. So having the ability to use these rapid test kits as a screen, and as you mentioned, as a QC screen, is vital for those type of companies to be able to have confidence in the sample they're receiving, and to be able to have the results so quickly. It allows them then to either accept or reject a certain feed that they have arriving. If there's anything that they're unsure of, then obviously they can follow it up with more testing. But it allows them then and there to, I suppose, provide that QC screen and that protection for themselves to determine whether they have an issue or not. So yeah, it's I've spoken with a lot of feed mills of late who are employing these technology, and it kind of goes hand in hand then with say, for example, the LCMS techniques, because then they find, okay, well, look, I may have an issue, and I've used the rapid test kit and I found something here, but I want to know the full extent, so then I can progress on and then get a more detailed test. So but yeah, it's a great tool for screening of such a high throughput feed mills out there at the moment.
And that's the thing, I think, particularly what we see around the world as more governments are starting to either put regulations in place or police regulations. Like you say, the rapid test kits are a great starting point, and actually then it can be used quite nicely in tandem with a more sensitive method to verify, what's being found using those quick tests.
Yeah, exactly. And I suppose to touch on that, I mean, EFSA is always updating its policies. It's always updating its regulations. It's always checking, keeping up with science. So as the science progresses, so does the regulation. It's kind of like the chicken and the egg, because the science is pushing the boundaries more and more, and then regulation, then you tend to find tries to catch up. But with the levels of contamination being dropped by EFSA, and making sure that more screening is carried out, these type of tests are essential to make sure that you're not breaking any regulations or rules across all the governments globally. So, and that's why we have our labs situated where we do, so we can facilitate the testing across the globe, i.e. in the US, North America, covering North and South America, and our European office here covering most of Europe, Africa, and Asia, and obviously then the Chinese lab that we have that looks after that market. So, yeah, it's an ever expanding remit that that we need to look at and take forward with the regulation.
And maybe that's where we see, obviously, the evolution from the Neogen AccuScan Gold through to the Neogen Raptor, the evolution of these Reveal ergot tests, now adding another mycotoxin, all around trying to make that use in the feed mill more streamlined, easier for the user, but also taking into account that ever-changing regulatory landscape and adding new mycotoxins. So, with the Raptor, you've used that a little bit there in the lab. What do you see different with that versus the Gold?
Well, essentially, I mean, the Raptor unit is more sensitive. As you said, it's newer technology from Neogen, so it does have that increased sensitivity when you're carrying it out. But also, as you touched on there, it has the capability then to carry out the analysis on ergots. And that's fantastic, because they're constantly trying to expand their method, and essentially the development work is there. So as you mentioned, with people looking to carry out the analysis, the more simple you can make things, the better. But also then the amount of mycotoxins you can quantify, the better as well, because you're providing that cover for this type of contamination that is out there. And I suppose, to touch base on both of them, having used them, I mean, the Raptor, it is a good setup. As I said, you can get results in. There is some prep, as I mentioned before, between grinding, weighing, and then obviously some case you might have to pH the sample depending on the sample. But realistically, the turnaround time is a bit quicker. And obviously with increased sensitivity, that's always going to be a bonus. But yeah, no, you can see the progression from the development in the technology. And I suppose the Raptor unit itself, it is a robust unit, and we've used it here on different samples that we've got in from feed mills as well, just to run checks and tests ourselves, and a small bit of developmental testing. But yeah, it is a very good and robust unit that's out there, and for customers and feed mills to use alike.
Well, and certainly from our point of view, we hope that through RapiRead, as you mentioned, we can capture a lot more data from the Raptor units around the world as they sit in those QC programs. So maybe then we can come on to 37 plus, and like you said, it's the gold standard, it's the reference method now using LCMS. And you talked about the three different sort of dimensions of the analytical method, and to me, almost a concept of different matrices, the fact that we can use it as a diagnostic method. So maybe start with the matrices. We can analyze more complex matrices using 37 plus that we cannot do with those more simple methods.
Exactly, yeah, you're quite right. So I suppose with LCMS, as I said, because it has that 3D approach, you are looking at being able to separate the compound first. Okay, so we run it through the LC, and all we do is essentially separate all the compounds from each other. And that allows us then to, I suppose, just gives that window to analyze each compound individually. And then what we do is we know from using standards and C13 standards, we also know then the weights of all of these mycotoxins, so we can put them through a mass analyzer then in the mass spectrometer, and we can filter out then each an individual mycotoxins. But then I suppose the crowning part of it is then at the very end, then we're also able to fragment these via collision cells and another mass analyzer to essentially determine the fingerprint of that compound. So we're able to, without doubt, hand on our heart, say this is the compound, because every compound out there has its own individual fragmentation pattern. And as I said, this is essentially its fingerprint. So no compounds will have the same fragmentation pattern. And if we were looking across these different mycotoxins, because they're all of different masses and different weights, what will happen is when we fragment them, we will actually get this different profile. And this profile then allows us to confirm that we're not getting interferences from different matrices, and that we're not getting increased signal due to a competing compound, because that compound will be removed via the filtration process in our mass analyzers. So it allows us that confidence in our method and in the lab here to essentially stand over the results we generate, and as you said yourself, Nick, quantify different matrices that we have for the mycotoxins that might be of concern. So yeah, so it is that's why LCMS is the gold standard and used across labs across the world.
And so what I'm hearing then, Patrick, is you take the concept where even if you have, say, 2 isomers of DON, and you look at something like a 3-acetyl DON or 15-acetyl DON, where in theory the molecular weight is going to be the same, because there's those 3 different steps, if you like, those 3 different approaches, they effectively filter out those molecules that are even the same weight, and they can still tell those apart.
Correct. Yeah, correct. So again, this comes down to the chemistry of the compound. So certain chemical bonds in the compound structure will break before others. So you will have different fragments that will come off at different times based on that interaction and with the chemical bonding. But also as well, then you'll have different interactions then with the stationary phase of your liquid chromatography, which essentially is another filtration process to allow the compounds to separate differently across the board. So that will actually have different retention times, even though they're coming out, even though, as you said, there are 15 versus 3 acetyl DON. But again, the method allows for being able to determine the differences between these isomers because of the slight differences in their structure. But again, it all comes down to those mass analyzers and being able to detect the differences between them and providing this different profile across the LC, the molecular weight, and then the fragmentation.
Which is then, I mean, super important if you think about the concept of the advancements we've made because of using the mass analyzers, and you think about the types of feed materials we can test. You think about TMRs now, and the complexity of those. We can't test those on the rapid test kits because there's too many molecules that will interfere with that antibody-based assay. So that's really key. And then also that wider range of mycotoxins. Think about, we're testing penicillium mycotoxins and all those different ergot compounds, the newer mycotoxins, the emerging mycotoxins, all that we're able to do because of that progression in the method that we're using.
Exactly. And I suppose to follow on with that point as well, you are able to invest more time and effort into expanding and detecting and working on other mycotoxins that could be present, because you don't have to develop a whole new, say, lateral flow strip You can essentially just get the standard of the mycotoxin that you're interested in. You can screen it for its retention time to make sure that obviously it's separating out okay in the first filtration process as we described, and you're going to know the molecular weight. So once you get your structural fragmentation of the compound itself, then you'll know what that is, what it looks like then going forward. So it allows for quicker development of the methods and expansion of the methods. I mean, we've increased from 40 to 54 mycotoxins in the last 12 to 18 months because of that capabilities that we have. But again, as you said, with the back to the matrices in particular, because of the nature of TMRs and even some finished feeds, there is a huge amount of other interfering compounds present, which again we can filter out via LCMS because of the capabilities of the instrumentation, and that allows us then to as I said, have confidence in the data that we're generating, and that's why, as you said, it is that go-to and the gold standard that's out there at the moment.
Well, Patrick, really appreciate your time to run through those methods with us. There's no doubt that 37 plus is the cornerstone of our mycotoxin management program. You know, we look to support that a little bit now with RapiRead moving forward and the information on raw materials. But quite frankly, without 37 plus, the program wouldn't be where it's at, because if we're not analyzing mycotoxins, then it's very difficult to go back to customers with any sort of risk mitigation strategies. And so certainly appreciate your time and the information, and we'll look forward to catching up with you again on some of these other areas around testing and maybe testing programs as we continue the MycoBite series. Thanks very much indeed.
Looking forward to it, Nick. Thanks very much.